Now, the Sickle Cell Health Awareness Perspective and Experience Study commissioned by Pfizer has highlighted the impact of the disease on those who have it, with 57% of sufferers feeling they have been given poor medical care. It's more important than ever to recognise World Sickle Cell Day, which is on the 19th of June. Well, joining us on the line now to tell us more about sickle cell is Stephanie George, who's a patient, Sherry Bricks, who's a carer of a patient, and Owen Marks, who's from the Rare Diseases at Pfizer. Welcome to the Mid-Morning in Conversation show, all of you.
Thank you.
Thank you.
Good morning.
Now, first of all, we know that sickle cell is an inherited disease, but can you tell us what exactly is it and who is most likely to suffer from it? That's to you, Owen.
Well, sickle cell is an inherited condition, and it affects red blood cells so that they're altered, and it means that they're much more likely to clot and create incredibly painful crises because there's reduced oxygen transport. So the critical thing about sickle cell is that it can really greatly affect patients' lives. And the survey you mentioned actually highlighted that patients on average miss up to 3 months of either school or of work. So it obviously has a huge impact on patients, but also on their families and wider society. So ahead of World Sickle Cell Day, we're really trying to highlight the importance of greater awareness of sickle cell, and if we can highlight the awareness, then we can do more for patients, because we really need to do that.
So, Steph, how did you know that you had it?
So I was a child. I think I was maybe about 7 or 8 that I noticed that, I had to, my mum and my dad would be like, you need to wrap up warm, you need to wear your scarf, you can't go outside and do what, other kids are doing. I think it's from then on I knew, okay, something's a little bit different. And obviously I had to go to my hematology, so my hospital appointments, to see the specialist that was looking after me. And then I think when I had a stroke at 9 years old, and I was in hospital for quite a bit.
Wow.
From then on I knew, okay, yeah, this is just, even though I wasn't talking to my friends about it, because at 7 to 9 you're still a bit young.
Yeah.
But I just knew that my other friends weren't going into hospital as much as I was, and that's when I realised about it.
Gosh, sounds absolutely horrendous. Sherry, you're a patient carer. So what's it like for you?
So the thing about sickle cell is that every single patient is different. Every single warrior suffers in a different way. My experience with my son has been that no 2 days are the same. I can send him off to school, he'll be absolutely fine, and 10 minutes later I will actually get a phone call from the school saying we've had to call an ambulance. You just don't know from day to day. I got married a couple of years ago, and my son, he was wonderful all day, smiles all day. He was my ring bearer. He gave a fantastic speech. He smiled. And then we went off to go dancing. I had the tap on the shoulder that said, Jacob's not well. Well, I hitched up my dress and ran over to him. We had to call an ambulance, and 2 hours later I was the best dressed bride in A&E. You just don't know. You don't know. And he, the thing about the sickle cell warriors, they show enormous grit and strength just to push through each day, and you don't know.
Gosh, oh dear me. Now, Owen, the study from Pfizer shows that more than half of the people affected believe that they've been given poor health care. Why do you think this is?
Well, sickle cell is a condition that the NHS itself has published reports that shows that there's quite a high degree of unwarranted variation in healthcare across the UK. But there have been real improvements, and it's critical that we work across the board so that the NHS, it's patient advocacy groups, it's policymakers, it's pharmaceutical companies like ours. We've all got to work together to continue to see how you can find improvements, because the survey showed that there are 15,000 patients who suffer from sickle cell in the UK, and yet for many people it's hidden. So we've got to change that. We have to highlight that sickle cell is a condition that a lot of people suffer from, but if we have better care and we all pull together to improve the coordination of care, then we'll see the improvements that patients need.
Now, Sherry and Stephanie, the vast majority of people diagnosed with this condition feel there is a stigma attached to having it. So why do you think this is, and how can this be changed?
Coral, I think there's an element of racism, and that this is one of the difficult conversations that we have to have, where there is obviously racism, unconscious bias, diversity and inclusion. Some staff members so I would say education is great, and it's good that we have that. But if we don't, if staff members don't want to change their ideals, and obviously sometimes it's just deep-rooted ideals that they may not even know that they have. But if they don't want to do that, change isn't going to happen. And a lot of patients will, experience substandard care. I'll give you an example. Last year, me and my sister, so my sister has sickle as well, we were in A&E together, and I was behind a curtain, and my sister was just standing by the curtain looking on her phone. So we're waiting for our nurse to go get our medication. The nurse that was there said that me and my sister were intimidating the patients. We were intimidating her, and we were, threatening her, even though she could not see me behind the curtain, so she didn't even know if I was there. And my sister was not looking. And the patients even looked at her like, what is she talking about? And when our nurse did come to give us the medication, she told the nurse to get us out of there right now because she felt threatened, for no reason at all. But it's those examples. Thankfully, not many people are like that. But it's those ideals that if, people don't get rid of those ideals or do the unlearning, the percentage will probably start, going up of patients not having, great care.
Oh, gosh. Sherry, do you think that this is just lack of education?
I think it's multiple factors. Stephanie touched upon the medical profession, but also as a carer, I've had to fight for my son on so many fields. So you take the educational factor. So, for example, in school, it's about making sure he has equal access. He's warm in a classroom. He's got access to go to the toilet because he needs to drink a lot of water. It's about having a joined up approach to sickle cell. It's about not seeing a child in the corner in pain and thinking that they're just playing up. It's about educating everybody so that they understand the condition. It's invisible. You can't see it, but it's about not having those preconceived stereotypes that, it's just a black person, they want drugs. We've had ambulance staff turn up and just assume that my son wants morphine. He's just there for the morphine. He just wants a hit. Well, no, they're in pain. You can't see it. You need to listen and you need to understand.
Sherry, how does having sickle cell disease affect your son on a daily basis? And this is also to you as well, Stephanie.
On a daily basis, it's challenging because it's a physical and it's also the mental disposition of having to fight, having to explain every single time. Fantastic. June the 19th, Sickle Cell Awareness Day. That's fantastic. But we have it 365 days of the year. And that's what needs to be understood. My son, at the moment, he's going for exams. He's had, and he's just come out of hospital. So he's had, he's got the physical aspects of, okay, I'm going to have to sit this exam, even though I'm in pain, even though I'm tired. I have to do this because, this is going to affect the rest of my life. But every day, for patients, for sickle cell warriors, it's about we have to push through. We have to push through.
And Stephanie, you?
Yeah, I completely agree with what Cherie said, because no 2 days are the same. You know, there's days I've woken up and I'm fine, and I've had, ended up in A&E either that afternoon or that evening. I'm lucky that I have a really good support system of friends who don't make me feel bad for cancelling at the last minute. And I think that it's really important to have that kind of support system, because sickle cell is really isolating. Like, me and my sister, we always say that we didn't want the other one to suffer, but at least we know we're not going through it alone. So we advocate for each other all the time. And that, I think, has helped me be a lot more confident about, talking about my illness and talking about how serious it is, and even just experiencing it, because I know I have someone right there with me who understands what I'm going through. And obviously it affected us completely differently. She's got certain issues that I don't have. I've got issues that she doesn't have, as a complication of the sickle cell. But we know that we're not alone. And I think that's the silver lining out of it, I guess. But yeah, it does affect me every day. Like right now, I'm talking to you, I'm in pain. And I've taken pain medication. But yeah, a lot of us have to just do that to get through the day. And it's not because we want, the medication. The effects of the medication are not nice. But yeah, it's just about, as Cherie said, just pushing through. And, because you don't want it to stop you. And I didn't want my illness to stop me from living the life that I can live. Because yes, I've got this illness, but I didn't ask for it. But it's there. My life has been around this. I've never known a life without sickle cell. So it's just about pushing through and, trying to live, as best as I can.
Wow. It seems like it's a really hard thing to live with, and you're doing incredibly well.
Thank you.
Owen, where can our listeners find out more information?
Well, we would really encourage people who are interested to look up the SHAPE survey. We'd really encourage them to read the APPG report, which is called No One's Listening. I would really just like to sort of respond to hearing Cherie and Stephanie share their experiences. The critical thing that we'd like to bring across for World Sickle Cell Day is that sickle cell is a condition that you wouldn't know someone has. And because of that, you look at people, and if they're not in the middle of a crisis, they look completely healthy. And so, like anything where it's not obvious to others that this person suffers from an incredibly debilitating condition, we just really want to raise awareness of that. And if you have that sort of compassion and understanding, then of course those people can look forward to better care, whether it's from people in the health service, whether it's from their friends. So that, as Stephanie shared about the response that her friends are able to offer her. So if we raise awareness, then we think that we can see massive improvements, and we'd really encourage people to learn more if they're interested.
Now, Owen, you're a pharmaceutical company. Is there money being put into the pharmaceutical companies to research sickle cell, or, for want of a better word, is it a Cinderella disease?
Well, it's an area. So in rare diseases and sickle cell, we've been investing for 30 years, and what we know is that the level of need in sickle cell is absolutely vast. So we're committed to continue to invest in the area. We're not alone, and there are other companies doing it as well. But the fundamental thing that's so important is, as long as new treatments continue to be developed, then we can make a contribution to better care, and that's absolutely critical.
Cherie and Stephanie, thank you both so much for being brave enough to tell us about your stories. I really do appreciate that, and I'm sure our listeners will as well. So thank you both very much for taking the time to talk to us. And Owen, also a big thank you to you as well. So thank you all very much, and we'll put all that information on all our social media platforms here.
Thank you, Cora.
Thank